So tonight's presentation is on Detox Essentials and Biological Medicine with Dr. Melina Roberts. And Dr. Melina, I've had the honor and pleasure to get to know this beautiful woman and instructor and doctor for the last 9 years. And she's definitely one of those innovative practitioners, definitely one of the top biological medicine practitioners in North America. She studied with Dr. Rao. He's pretty much the guru for biological medicine right now in the world. And she studied at his clinic. She's probably taken every single one of his courses. And so one thing that I really admire about Dr. Roberts is how she's able to take biological medicine from a European perspective and really put it into the Canadian and American perspective so that practitioners can understand and utilize biological medicine and incorporate it into their practice, and also for patients to be able to, get well, get better in a way that conventional medicine may not always be able to address. So Melina and Dr. Roberts really has a very unique way of bringing this information to practitioners so that they can help their patients and really, really look at the root cause of disease, not just the symptomatic picture, but really addressing the underlying, the terrain, the milieu, the environment in which the body lives in, and how cells are reacting and disease is upregulating or downregulating. So it is truly, truly my pleasure to welcome such an amazing person, beautiful speaker, very educated and really down to earth, an amazing practitioner to be able to be presenting such knowledge to us, and so we get to suck that up. So without further ado, it's my honor to bring forward and present Dr. Melina Roberts for you.
All right, thank you. That was a wonderful introduction. Thank you. So now I don't really need to introduce myself because Angela did such an awesome job. So we're talking about Detox Essentials today, so if everyone's in the right room and you're not just coming for dinner, which I heard that's how Angela was enticing people to come. Well, I want to thank you guys all for being here because I think that it means a lot that you're here because I think that we all have busy schedules. So thank you for taking time out of your busy days to be here and, expand your knowledge and learn new information. And what I'm going to be doing today is just sharing my knowledge with you. So thank you so much for being here. Let's start with that. I tend to do a lot of webinars. And I really enjoy doing these live events because webinars, it's kind of this weird concept where I'm sitting in my office pretty much talking to myself and I have no feedback whether anyone's understanding what I'm saying, whether anyone's even taking notes or people are sleeping. I have no idea what's going on. So this is really nice to be in this kind of situation where I'm at a live event. So thank you so much for being here. So just a little bit about me. Went to the University of Waterloo. I went to CCNM in Toronto, graduated in 2004. After I went to the Naturopathic College, I did some extra work in European biological medicine with Dr. Thomas Rao. And I actually just met up with Dr. Rao about 2 weeks ago. And it just got me reflecting on how did I actually get into biological medicine. And what happened was that after I graduated from the Naturopathic College, I joined a clinic. And I joined this clinic mostly because I had heard that there was this clinic that was doing really well in terms of being able to treat cancer. And my dad had, unfortunately, had passed away of cancer when I was a student at the Naturopathic College. So I was really interested in cancer and what people were doing, how people were treating it, who was having success. So that's what really got me interested in this clinic. And when I arrived at that clinic, they were doing a whole bunch of different things, testing and treatments and therapies that I had not seen through my naturopathic education. So I was really intrigued by it. And the owner of the clinic, when I arrived, he said, you know, if you go to one seminar, you got to go to this one seminar. So, you know, he put so much weight on that seminar. So I was like, okay, I got to go to this seminar because he says it's important. So I ended up going to Marion, Massachusetts, and the speaker was Dr. Thomas Rao. And he was talking about biological medicine. And I was really interested in biological medicine. It really resonated with me. It really made sense to me in terms of my naturopathic training and my scientific brain. It all just made sense. And so after I saw that, I was really intrigued in biological medicine. And what he had was a 2-year program, certification program, and a 1-week internship at his clinic in Switzerland. And I really wanted to do that. It sounded great. The challenge is that I would have to fly to all of those courses and fly to Switzerland to do that internship. And I remember I was a new grad, I was newly married, and I was just trying to figure out if I was going to be able to afford to do all of that extra training. And I remember crunching the numbers with my husband, and my husband said, if this is something you really want to do, let's just make it happen, right? So I ended up doing the training, and it's really been a huge influence in how I practice today, and how I even just see patients, and how I approach any sort of disease process is looking at it from a biological medicine perspective. So I'm the founder and clinic director of Advanced Naturopathic, and that's really the focus of what we do is biological medicine. And I'm also the author of a book called Building a Healthy Child. And this book is really made for parents. So it teaches parents how to introduce foods in a way that really helps to build the foundation of their health. Because what I was finding was that as I was treating patients who had any sort of chronic disease, what I always had to do is I always have to work on healing their gut. And what I was finding was that in terms of any disease processes, we always have to heal the gut. And then when I had my daughter, I thought, is there a way for us to be able to build up her health right from the beginning? So build that foundation. And I figured out that there was a way for us to build that foundation of health right from the beginning. And one of the major ways is how we introduce foods and being able to do that properly. So that's a little bit about me. So why detoxification? Why is this such an important topic? Now, I think that if we are going to be able to have a influence in terms of changing the health of the population, then we need to learn how to properly and effectively detox our patients. So this is going to be a priority because really we live in a hugely toxic world, and we need to be able to effectively move those toxins out of the body. I'm going to just go through a little bit about detoxification because I think that there's so many detox programs out there, and I think that a lot of them are really good at mobilizing toxins, but in a lot of cases they're just moving toxins from one area of the body to another area, but not effectively moving that toxic load out. And I know that there's another camp of people, I see that happening on the internet, where people say, we don't need to detox because our body already naturally detoxes. But at this point in history, our systems are just assaulted with so many toxins, so much more toxins than our system or throughout human history has ever had to handle. And our systems just can't handle the amount of toxins that our systems are really assaulted with. So how are we getting this exposure? One of the ways we're getting it is through our environment. So things that are coming in, we call them exogenous toxins. So it's the toxins that are coming in from the air that we breathe, the water we drink, the foods that we eat. We're getting them from the metal amalgams. We're getting it from drugs that we're taking in. There's so many ways that we're getting toxins in from that external environment. But we are also getting toxic loads in from our internal environment. So this is the breakdown of the cells. This is that cell debris, all those different waste products, because we can't properly break down our foods. So we actually produce a lot of toxins within us. So those are two ways that toxins are actually coming into our body. And I'll just go through some of those exposures. And industrial toxins is a big one. And I think that when a lot of people think about industrial toxins, they think about our proximity to that industrial plant. So a lot of people think, okay, well, I don't live close to an industrial plant, so it doesn't affect me. And the truth is that yes, if you live closer, you're going to have more concentrated versions of those toxins getting into our bodies. But the truth is that those toxins, they go into the air. Then from there, they go into our water. The water gets into our soils. The soils from there get into our foods. And from there, it gets into our bodies. So as long as we are all sharing the same planet Earth, we are actually all affected by these toxins. So it's not just about proximity. Now there's those agriculture ones. So it's our foods that are sprayed with the pesticides and herbicides and insecticides, and our foods that are injected with hormones and antibiotics. So we are getting a lot of toxic loads from the foods that we're eating. In our households, the building supplies, so there's a lot of off-gassing from the furniture, from the carpets, from the paints. So even our internal environment in our homes, and what they've actually shown is that in our homes, we are actually getting a higher toxic load than there is outside of our homes. And that really happens very much in Canada because our houses are built so well. They're very well insulated, so we keep warm inside our houses, but it means that there's not a lot of airflow, so we actually end up with a high toxic load within our homes. Another big one is personal care products. So this is the stuff that we're putting on our skin every day. And those personal care products is a very unregulated system. So the amount of toxins that most people are putting on their skin is quite high, and they're doing that on a daily basis. And what you have to be, like, they don't have to put everything onto the label that's actually going into the product. For example, when you see on the label where it says fragrances, that can actually mean that there's 50 plus chemicals. So think of how many chemicals most people are putting on their body on a daily basis. So that's everything from creams, shampoos, makeup, cosmetics. And then the food toxins. So that's our GMO foods. Those are all the additives that we're taking in. So the food colorings, the artificial flavors, the artificial sweeteners, all the preservatives, all those extras that are in our foods. And when we read them on the label, they're all those chemicals. So why does this matter? Because those amount of toxins are actually negatively affecting our health. And it just comes down to a lot of numbers here, right? We got 74 billion pounds of chemicals that are coming into the US every day. And I assume that our Canadian statistics aren't that far off. So just the amount that we're taking in. There's approximately 800 80,000 chemicals on the market, and most of them are used on a daily basis, and most of them are understudied or unregulated, and 90% of them have not been tested for human health. When they tested the blood of a number of patients, there was 104 that were ubiquitous, which means that they were in everybody. And what they're finding is that 80% of the toxins that we have within us are called non-persistent chemicals. And initially, what we thought was that those non-persistent chemicals weren't a problem because they had short half-lives. And they weren't a problem like things like heavy metals or DDT that had longer half-lives. But the challenge is that we are exposed to these 80% of the chemicals, these non-persistent chemicals, on a daily basis. And that's why they become a problem. So those non-persistent chemicals are things that we're going to be in our foods. Those are the personal care products. Those are the ones in our environment. So the phthalates is a big one. And what's kind of sad is that when they check the umbilical cord of babies, there is lots of environmental toxins in our babies. So they're actually starting behind the 8 ball. They're starting at a disadvantage. They're coming into this world with a high toxic load. Now, there's a parallel by the increase of toxins. There's also been an increase in chronic disease. And we see this from, there's a huge list here from obesity to diabetes to cancer to autoimmune disease. We just see an increase in disease processes as we see an increase in toxins. And what's really interesting is that I was reading a book by Dr. Brizono. He's a naturopathic doctor, and he wrote The Toxic Solution. And one of the things that he was pointing out was that we've seen an increase in type 2 diabetes. And he actually showed a correlation between an increase in toxic load and an increase in diabetes. I was always under the impression that the reason we see an increase in diabetes is because of the increase in our sugar consumption, because we've seen a 10-fold increase in sugar that we're consuming. And I think that for sure plays a role in it too. But what he was showing is that there's some toxins that actually poison the insulin cell receptors. And that has actually led to an increase in diabetes in our population. And with that increase in toxins, we're seeing an increase in disease. And really, when you have an increase in toxins, we have an increase in inflammation, and inflammation is really the root cause of all chronic disease. We also see a decrease in vitality, and what we also see is when we have a high toxic load in our system, we also have a high amount of free radicals. So we have oxidative stress, and that's like basically internal rusting, which is aging. So we also see rapid aging. So I know there's a big thing about anti-aging medicine. And anti-aging medicine is really getting rid of all of those free radicals, that oxidative stress in our body. So what we're doing here, what you're going to learn today, is anti-aging medicine. Okay, so there's 3 parts to detoxification. And just a little note in terms of toxins is that, sometimes we have different names for toxins. We can call them carcinogens. We can call them hormone disrupting chemicals. We can call them neurotoxins. But regardless of the name, what it means is that the chemicals that are coming into our body are disrupting the proper function of every system of our body. So depending on the different chemical, it might disrupt another system a lot more, but those chemicals are disrupting normal function. So what we need to do, I divided it into 3 parts to detoxification. So one is that we have to limit our exposures. So we got to decrease the amount that we're actually being exposed to these toxic loads. We have to do the detoxification, and that's going to be the primary thing of what I'm going to be talking about today. And you know, there's parts of that detoxification. We got to do drainage, and we got to do this biotransformation. And then we also have to promote elimination. We got to make sure that we're eliminating so we can move that toxic load out of the body. So limiting exposure. So anyone who's studied with Dr. Rao will know about, he'll talk about this barrel of toxins. So what he talks about is that over your lifetime, we will accumulate a barrel of toxins. So whether you realize it or not, whether you have symptoms or not, you are accumulating toxins within your body. And when that barrel starts to overload, that's when we start to see symptoms. So even if you don't notice symptoms, you're still accumulating toxins over a lifetime. And different ways that we're accumulating toxins is from the water we drink. And in our tap water in Calgary, I think we're all from Calgary, tell me differently except for Angela, our tap water has chlorine in it. Chlorine is really will kill off all the good gut flora in our bodies. And then in fluoride, I don't think we have the fluoride in our Calgary water, but elsewhere in the world, when they're getting the fluoride can be quite a toxin to our system. And then we're getting it from the air pollution, everything that's off-gassing into our system, into our environment. And we're getting it from the foods we're eating. So personal care products. So we got to come up with some tactics, right? So what are some tactics that we're going to limit exposure to this toxic load that we're getting in? And one of the ways is to eat organically grown foods. And Dr. Mark Hyman, if you guys are familiar with him, he says that if you want to eat toxins, then you can eat regular food. But if you want to decrease those toxins, then you eat organic food. And I kind of like that he just gets pretty blunt and to the point. He's like, if you want to eat toxins, then go ahead, right? But if you want to eliminate those toxins, then we got to switch over to the organic foods. And I know that that's easier said than done and that there's an expense attached to that, but it's very true that we are, unless you're eating organic, you are taking in a whole bunch of toxins. And we want to avoid the processed foods. And the processed foods, those are the ones that are going to have all your extra additives. It's going to have the extra food additives, the food colorings, the artificial flavors. So by removing those processed foods, we eliminate a lot of that toxic load that we're taking into the body. And we got to be careful with the cookware. So a lot of that cookware, aluminum cookware, Teflon cookware, that's ending up in that's leaching into our foods. There's going to be better options. Better options are going to be your cast iron, your titanium, your ceramic, stainless steel. Those are going to be better options in terms of cookware. We want to limit alcohol, because when you're having alcohol, even though Angela was promoting it earlier, so we're going to limit alcohol because every time you have alcohol, it's going to be congesting up the liver. Just being mindful of that. And just installing air filters into the home does help to decrease that toxic load in our homes. Switching over to natural cleaners will help to also clean up that load in terms of our home. And we want to change up our personal care products and make sure that the personal care products that we're using are non-toxic. And another thing, we want to clean up our water and we want to be drinking filtered water. So activated charcoal carbon filters at the very least, and also I'm a fan of reverse osmosis water, but we want to clean up the water supply. So those are some of the tactics to limit that exposure. Now what happens when these what happens is that these different toxins, so the toxins that are coming from the external environment as well as the internal environment, they end up in our blood. And then what happens is that we have our detoxification organs, so liver, kidneys, lymphatic system, lungs, skin, our gallbladder. So these are our detoxification organs, and they need to be working well to effectively move that toxic load out. But there can be, say you have a congested liver, your lymphatic system isn't properly draining, you got weak kidneys, your gallbladder is all congested, your lungs, you're not properly breathing into your lungs, and your skin might not be affected, you might not be sweating. I know that I'll come across patients who say, oh no, I'm not really a sweater, I don't really sweat. And sweating is a way that your body's actually moving toxic loads out. So if those pathways aren't working very well, what happens is then the toxins move into the connective tissue. So they move into that extracellular space. And as they build up in that extracellular space, they then move into that intracellular space, so inside the cells. And when they're inside the cells, this is when it can disrupt that DNA. And so this is a big topic because this is when the toxins are within that cell, it actually can affect that proper DNA replication that's constantly happening. And when that replication is just slightly off, that's when we get these things called mutations. And we see this, I know that that's a big area of study right now, is the genetic testing. And for sure, I think that we all have innate weaknesses in terms of that genetic testing, but there's also this thing called epigenetics. And that means that if we can change the environment, then even though you have those genes, you may not express those genes. So I think that that's really important to know, especially when you do genetic testing. I think genetic testing is really cool. I think it's a really cool area of study. But if we can clean up the system and change up that epigenetics and make it so that we're not causing a lot of those mutations, then we can actually not have those mutations be expressed. So that's kind of my touching a little slightly onto that genetic testing. Now, I think it's also important to know that in terms of detoxification, detoxification happens when we're in our parasympathetic state. So what we have is we have our autonomic nervous system. So that's the nervous system that's going on in the background. We don't consciously control it. There's two parts to that nervous system. There's your stress state, which is your fight or flight. It's the run away from the tiger. It's your stress response. And then there's the other part of your nervous system, which is your parasympathetic nervous system. And I spelt that wrong, I see. So it's your part of your nervous system where you do your rest, digest, repair, and detoxify. So we need to make sure that our patients can shift into that parasympathetic state. And parasympathetic state is when we are in our more relaxed state. And then we also go into parasympathetic during our sleeping hours. So those are the two times that our body is doing the most detoxification. So this is why we need to work on decreasing stress in our patients' lives, as well as we need to make sure that they're sleeping really well. So sleep is really important because that's when your body is doing a lot of its detoxification. Now, a great remedy in terms of helping to calm down that nervous system is Aveeno. And Aveeno just helps to calm that nervous system, shift that body into that parasympathetic state. And this is where we talk about like mindfulness and meditation and yoga and, you know, like all of those things that just help to calm the nervous system. These are all things, and then we also talk about sleep hygiene and making sure that people are going to sleep at the same time and waking up at the same time, and they're sleeping in a dark room and it's cool, and they're making sure that they get enough sleep because that body's detoxifying. So all of those things fall into this important state in terms of switching into that parasympathetic nervous system. So I think that's just be mindful of that. So now we got these emunctories, and this is what the Germans basically call, you know, we call them detoxification organs, and they call them the emunctories. But we have your primary emunctories, and then you got your secondary emunctories. Those primary emunctories are the liver, the gallbladder, the kidneys, the lymphatic system. And what you need to do is we need to work on the primary emunctories before we work on the secondary emunctories. And we got to really take this into consideration because, you know, we're going to have patients who come into our office with psoriasis, with acne, or they'll come in with asthma, and we'll be so tempted to want to work on those secondary emunctories when really we need to be first opening up those primary emunctories before we can work on those secondary emunctories. So this is very important. Okay, so when we talk about the lymphatic system, so the lymphatic system is a closed system, and about 80% of that lymphatic system is actually housed in the gut. But I think it's really important for us to understand the flow patterns of the lymphatic system, because you're going to understand why we need to do things in certain orders, or why you see certain symptoms show up in the system. So the superficial lymphatic system drains the head, the neck, the skin, the breasts, everything superficial. Then we have our deep lymphatic system, and the deep lymphatic system drains all of our deep vital organs. So the superficial lymphatic system drains into the deep lymphatic system. You got to see this like a funnel, a closed funnel. So it drains into that deep lymphatic system, then it all filters through the liver and empties out the colon. So what happens is that if you have a colon that's not properly eliminating, so you have a patient who's constipated, it's actually going to block up the liver. Then you're going to have a congested liver. And then it can block up those deep lymphatics, and then we start to see symptoms showing up in those superficial lymphatic system. So that's when you see those chronic sinus infections and chronic ear, nose, throat infections. You see enlarged lymph nodes. You can also see it in terms of, we see it also in terms of like breast cancers, right? The breasts aren't properly draining in terms of that whole lymphatic system. So these are different symptoms that we can see, and it's happening at that superficial lymphatic system, but it's because that whole system can't properly drain. So you always have to see, where's the blockage point? Is it that deep lymphatics, liver, colon? So in terms of moving that whole system, in terms of being able to properly drain those toxins out, we got to make sure that we're properly eliminating. So I did an entire lecture just on this slide, but I'm going to fit all of this slide into, or that whole lecture into one slide. Okay. So what we first need to do is we got to decrease the inflammation. So I call that putting out the fire. And how we're going to do that is we got to eliminate those major inflammatory foods. So those major inflammatory foods are wheat, cow's dairy, and sugar. So those are foods that when we're eating them, they're causing inflammation in the mucous membranes of our digestive tract. And I always say that, you know, when that fire is ablazing, you can't do any of the healing. So you have to remove those inflammatory foods in order for us to heal up the lining of the digestive tract. So this is really important in terms of healing up the digestive tract. Then we got to heal the lining of the digestive tract, and there's some great remedies for doing that in terms of healing up the mucous membranes and also healing up those tight junctions. So the NAG, so the N-acetyl glucosamine, that helps to actually heal up the tight junctions of the digestive tract, and L-glutamine helps to actually heal up the mucous membranes of the digestive tract. So healing up that whole lining. And then the other thing that we need to do is we need to balance out the microflora, so that whole ecosystem of microbes that live within our digestive tract. We need to be able to balance that out. And so for us to be healthy, we actually need to have a very diverse microbiome. So it has to be filled with lots of different colonies of bacteria and fungus within our gut. And we need to have this balance of what we call healthy bacteria and unhealthy bacteria. And if we're eating foods that our body can't properly break down and metabolize, then we actually, what happens is that it leads to an overgrowth of the unhealthy bacteria. And then that unhealthy bacteria, when it tries to digest your food, then it actually leads to an increase in these endotoxins. And those endotoxins cause more inflammation in the gut and also are more toxic and congest up the liver. So that's why it's so important for us to balance out this microbiome. And the Sanum remedies are really great for helping to balance out that microbiome. And then we need to increase fiber. So I know this is a challenging term, because I think that a lot of people, when they think of fiber, they're thinking of those bran muffins. They're like, oh yeah, I eat some bran, I get those in the morning, and that's how I get my fiber. And so how I describe fiber is mostly you're getting your fiber from your vegetables, and the other way you can get fiber is from your healthy fats. So chia seeds, hemp hearts, flax meal. And what happens is that those fibers help to bind onto those toxins and carry them out of the body. So we need to have fiber in our bodies in order to, first of all, those fibers help to feed that healthy bacteria, but it also helps to bind onto the toxic load and move that toxic load out through our stools. And then the other thing that we have to do is that we have to reestablish and re-educate the immune system, because just on the other side of those mucous membranes is a huge part of our immune system. And one of the ways that we can reset and reestablish that immune system is with a remedy called, I don't even have the names up there, Pleorebisan. And the challenge is that if we're not effectively moving our bowels on a regular basis, there's this thing called endohepatic circulation, which means that we actually reabsorb that toxic load if you're not moving your bowels at least once a day. So ideally, we should be moving our bowels 1 to 3 times a day. If they're not moving that frequently, then I put you into that constipation category. And what's happening is that you're reabsorbing that toxic load and you're further congesting up this liver. So that's why it's really important that we make sure we promote elimination. Now, I'll start with the liver. And how do we even know that the liver is out of balance? And there can be a number of different symptoms, and it can affect a number of different systems in the body. So liver plays a big role in terms of digestion, so we can see some bloating. The liver and gallbladder work really closely together, so if the liver is not functioning at its best, then we can see some imbalances happening in the gallbladder. And one of the roles that the gallbladder plays is digesting fats, and so we can see some difficulty in digesting fats. And I'll go into gallbladder in a bit more detail. We see some skin issues showing up with the liver because what happens is that your primary organs of detoxification, so your liver and your kidneys, if they're not working at their best, then your body will push that toxic load out through the skin just because it's one of the largest organs. So when we see skin happening, it's often related to liver or kidneys. And I'm going to go through in the next slide that hormonal connection, but the liver is where all of your hormones are metabolized. So if we're seeing any sort of hormonal imbalances, it can be related to the liver. Now, remember I talked about that, that flow chart in terms of the flow chart of the lymphatic system. And so if that liver is congested, then it backs up that lymphatic system and we start to see symptoms showing up in terms of that lymphatic system. And we also, when that liver isn't working at its best, that means that toxic loads are staying within our body and causing inflammation in different tissues in our body. And so this can range from us having pain over the liver. One of the common things I see is this one where people are actually waking up between 1 and 3 a.m. because the liver is the most biochemically active between 1 and 3. And sometimes when people are coming in with sleep issues, it's actually due to being liver congestion. And so we need to be working on their liver. And another common symptom I see is nausea. So they're coming in with some unexplained nausea, and that can be related to the liver congestion. And then the emotional components that we see in terms of liver would be anger or upset. So that can go hand in hand with liver congestion. Now, what happens is that in terms of that hormone connection to the liver is that the liver makes cholesterol, and cholesterol is the building block of all of our hormones. So it makes the hormones for the ovaries and the prostate. It makes the hormones for the adrenals, and it makes hormones for the thyroid. So if we have imbalances in any of those hormonal systems, it can actually be related to liver. So keep that in mind too when we're seeing patients. Now we get into this big topic of phase 1 and phase 2 detoxification. And really, in terms of these phase 1 and phase 2 detoxification is that the liver, it's filtering 2 liters of blood every minute. And what it's doing is it's changing toxins into a substance that our bodies can easily and effectively and safely move out of the body. So we got phase 1 detoxification. It's the cytokine P450, and it's made up of 50 to 100 enzymes. But what's actually happening is there's like 3 main things that happen in this phase 1 detoxification. One is that toxins are neutralized. And when toxins are neutralized, what happens is that our body actually creates free radicals. And these free radicals actually have to be quenched by a really strong antioxidant, which is often glutathione. And that glutathione has to be able to quench all of those free radicals in order for those substances to be able to move into phase 2 detoxification. So glutathione is really important in terms of this whole phase 1 and phase 2 detoxification. We need it as a nutrient for phase 1 detoxification. We need it as that intermediate because it needs to be able to quench all of those free radicals. And we also need it for phase 2 detoxification. So if that glutathione, if there's so much toxins that glutathione also gets all used up, then it actually can stop phase 2 from happening if we don't have enough of that glutathione. So that makes it a really important nutrient. But we need a number of those nutrients in order to activate that phase 1 detoxification. So we need all those B vitamins, we need glutathione, we need iron, we need proteins, we need those flavonoids. And then, I'm still talking about phase 1. So we neutralize toxins. The other thing that phase 1 does is that it also changes fat-soluble toxins into water-soluble toxins. And then the other thing is this transformation. So it converts, it kind of just changes that molecular configuration of that toxin, and it just makes it easy for us to move that toxic load out. So that's basically what's happening in phase 1 detoxification. And then we have phase 2 detoxification, which is basically it's 6 different pathways that we need to be able to support in order to effectively move that toxic load out. And for us to activate that phase 1 detoxification, we need a number of nutrients. So we need the magnesium, we need the B vitamin C, we need glutathione in phase 2 as well. And then we need all of these different ones. I'm going to be reading them out. So the folic acid, the choline, the sulfur, the protein. And we need all of that in order for phase 1 and phase 2 detoxification to go through to completion. So very important, and I think that we can spend so much time in this area. But I think what you also need to realize is that we need to realize that, like, where does this biochemical reaction happen? So this reaction all happens inside of the cell. Okay, so keep this in mind. Because what happens when you have a lot of toxins in that extracellular space? So, I call it the extracellular space. That's what I was taught in school. Germans will call it the milieu. And what I'm seeing now in the more recent research is it's being called the microenvironment. But what it is it's all that extracellular space. And if we have toxins just filled in that extracellular space, then it's going to be really tough for us to get the nutrients into the cells in order to run that phase 1 and phase 2 detoxification. Are you guys with me so far? Because this is the big part of what biological medicine is all about. And this is what I think, this is kind of the gap between functional medicine and biological medicine. It's just taking this one step further. I had the pleasure of being able to watch a speaker. Her name is Dr. Mina Bissell, and she is one of the top cancer researchers. She runs a really amazing lab. And what she's finding in her research is that when it comes to cancer, cancer is about proper cell communication. But in order for cells to be able to communicate, they need a clean environment for them to live in. And what she's talking about is she's saying that if that microenvironment is all filled with toxic loads, it makes it hard for those cells to properly communicate. So, and really that's the essence of what biological medicine is that if we have a hugely toxic microenvironment, then we can't have proper cell-to-cell communication. She also goes through and she does like some pretty cool research, because she says that biochemistry in the body has to happen in a 3D environment. That we can't be doing studies in petri dishes about the human body. We need to be looking at it in a 3D world. So she actually, how she sets up experiments is she looks at it through she does it in these 3D cameras looking at this different biochemistry. So it's really cool, and that really makes sense to me. It makes sense to me in terms of that microenvironment is extremely important to proper health. And it makes sense to me that we need to look at the body in terms of our we have to look at the body that is 3D, that it's not just a 2D system. And so this research, I think, is, I know it's groundbreaking. She has a TED Talk and tons of research papers, but this is the basis of what we know in biological medicine as well.
Does she know about biological medicine?
She doesn't, actually. Yeah, because that's one of the things that people were putting their hands up and saying. She was saying, well, okay, we know that this is one of the major problems, but what do we do about it? And she said, you know, we still need to do further research, right? So, but we got solutions. That's the cool part. So we need to understand that there's two types of cellular metabolism. So one is, and I don't know if I can do it one at a time. Yeah, okay. So that one is that we actually use oxygen. So it's when cell metabolism happens in an oxygen environment, it happens in the mitochondria. So what happens is that we take in those sugars, we go through this process called glycolysis, we make pyruvate, that pyruvate goes into the mitochondria, we need oxygen, and then we manufacture ATP, which is energy. And so this is good, healthy cell metabolism. Now we also have another type of cell metabolism that can happen, which is that we ferment sugar. And what happens is that the sugar comes into the system, we actually don't have enough oxygen, so it goes through that glycolysis, it makes pyruvate, and then because we don't have enough oxygen, we actually then make lactic acid within the cell. So we start to produce all of this pathogenic, this toxic load, lactic acid inside the cell. We also make carbon monoxide within the cell, and that actually disrupts our ability to be able to utilize and pick up the oxygen, which further makes this problem worse, and we make more of this lactic acid in this anaerobic, so this lack of oxygen environment. So in dark field, we can actually see this difference, right? So it depends on if their cell looks like this, or sorry, their blood looks like this, or their blood looks like this. Do I have a pointer with this?
Yeah, you should go to the middle.
The middle one is a pointer? Ah, look at that. Okay, that's way easier. Okay, so your blood, when the blood looks like this, and this is what we do within our test, and it's part of biological medicine, is dark field microscopy, and we look at the live blood cells underneath the microscope. But ideally, the blood should look like this, where you have your red blood cells. They should be perfectly round, all about the same size, and nicely spaced out, right? And so when they're spaced out like this, it means that oxygen can get in, nutrients can get into those cells, and also toxic loads and CO2 can get out of the cells. Now, when we have, I might need water. So then when we have blood that looks like this, you can see that the actual cell membranes are all stuck together. And when the cells are stuck together like this, it makes it really challenging for us to be able to properly get, thank you, for us to properly get oxygen into those cells, because it's the cell membrane where we take in that oxygen and take in those nutrients and then get rid of that toxic load. So you can see that it's really challenging for these cells to be able to do their job when the cells are like this. So the real question is how can we change up this environment, right? That's what we really need to be focused on. When we can change up that environment, then we can actually get the cell metabolism to work the way ideally it's supposed to work. Okay, and then we have our mitochondria, and I think that this is also a big area of study. We talk about mitochondrial dysfunction. So what should happen in proper cell metabolism is that we take in oxygen and we take in the proper nutrients, we go through glycolysis, we go through the Krebs cycle, and then that mitochondria just starts spitting out ATP, which is the energy, and we need that ATP to be able to support every metabolic process in the body. So this is the powerhouse of the cell, and it has to be functioning well in order for us to support every metabolic process in the body. So in order for us to support the mitochondria, we need a number of great nutrients. So we need your CoQ10, and we need the L-carnitine, and we need the D-ribose in order to give the body the raw material. We need the cofactors like magnesium and all your B vitamins. We need the building blocks, so your omega-3 fatty acids. You need your alpha-lipoic acid in order to recycle that whole system. But remember, with all of those nutrients to support the mitochondria, we got to make sure that we have to be able to get these nutrients into the cells. So this is our challenge point, right? So the challenge is that you can be taking all the right supplements, you could be eating all the right foods, but if these nutrients can't get into the cell, then they're of really no benefit to us. Okay? Because these are our challenge points here. Our challenge is that what if we have absorption problems? What if we have so much damage to the digestive tract that we can't properly absorb the nutrients from the foods we're eating or from the great supplements that we're taking? So this is one challenge. The other challenge is the one I was just talking about, is we have this hypercoagulation. So when we have a lot of inflammation in the body, that's when this occurs. A lot of inflammation, it makes it hard for us to properly get the nutrients into the cells. The other challenge point is when we have cells that look like this. So the cell membrane should be perfectly round. And if we have the cell membranes that are disrupted, and what this is actually oxidative damage or oxidative stress to these cell membranes. These cell membranes are damaged, and when these cell membranes are damaged, then we can't properly get nutrients into these cells. So these are our challenge points here, and these are the things that we need to be working on improving in order for us to be able to properly detoxify the body. So some of the ways that we can change up this terrain is we need to alkalinize the milieu. We need to alkalinize that extracellular space. When we alkalinize those tissues, then what happens is that we can get those cells to separate, and then we can start getting the nutrients in. And one of the ways that we can do that is we can do that with something called the Alcala powder, or the basic tabs. And the Alcala powder is made up of sodium bicarb, it has potassium bicarb, and it also has a sodium citrate in it. Because one of the questions I'll often get from patients is, well, what's the difference between me taking baking soda and me taking Alcala? And baking soda is just made up of sodium bicarb. Now, one of the things that the Alcala helps to do is it helps to support the sodium-potassium pumps that are in the membranes of these cells. And so it helps to alkalinize the tissues, it helps to support that sodium-potassium pump. And what they're showing is that because of our North American diet, we actually have a ratio of sodium potassium. It's become a 3-to-1 ratio, which has actually increased the acidity of our tissues. So what the Alcala powder does, it actually helps to balance out that ratio of that sodium to potassium, because that ratio is actually making our tissues even more acidic. The other thing that we need to do is we need to actually try to help to move that toxic load, that acidity, out of the cells. And one of the ways that we can do that is with these great remedies, these Sanum remedies. And I really don't think that there's anything that can replicate these remedies, because the Pleosanivus is made up of these organic acids, and it helps to actually remove that pathogenic lactic acid out of the cells. So that's what the Pleosanivus is doing. So it's moving that lactic acid out of the inside of the cells. And then what the Pleocitro helps to do is it actually helps to, this is kind of fuzzy, it looks fuzzy to me, it might probably fuzzy to you, but it actually helps to support this Krebs cycle here. So by helping to get that Krebs cycle to move within that mitochondria, it actually helps to make sure that we're moving that pathogenic lactic acid out and helping that whole system to work, helping that mitochondria to be able to effectively make that ATP. So this is how we can really support that. This is going to be supporting that extracellular space, and these ones are helping to move that toxic load out of the cells and help to support that mitochondrial function. Now, drainage, and I'm going to talk a little bit about drainage, and a question that I'll often get is, what is the difference between drainage and detoxification? So what drainage is drainage is helping to really move toxic loads out of that intracellular space and that extracellular space to help prepare those detoxification organs to be able to do their jobs. Drainage is really the foundation. It's what we need to do first before we can do those detoxification. So we have to do it in this order in order to effectively get things moving. And so drainage it's not a new concept. It's been around for 6, I think, generations now. And the Nestmann remedies are just known in Europe as, they're known as drainage remedies, and they've just been around a long time. And what they're helping to do is they're actually helping to increase circulation to specific systems and organs of the body. It's very targeted elimination. And what they have in them is they have biochemically active ingredients in the body. And I think that a lot of other companies try to replicate drainage remedies, and the challenge is that they're not having that biochemically active component to them. And it's helping to remove that toxic load from that extracellular space and help to properly drain that out. And so by cleaning up those tissues, it's draining, repairing, and then we can get some proper regeneration of those tissues. So it's very targeted to different systems of the body. It just helps to increase that blood flow and help to drain that toxic load out. So I'm a big fan of these drainage remedies, and I actually use them quite a lot in my practice. And I think that, like we can come up and say, okay, well, I'm seeing based on symptoms that the liver is more congested. But you also have to think about, what level are we actually working at in terms of treating that organ? Are we working at that nutritional level? Does that organ just need that proper nutrition in order to be functioning better? Are we working at this botanical level, which is helping to support that organ biochemically? Or are we working at that homeopathic level, which is actually working at that deep cellular level in terms of supporting that organ system? And I do want to make just a brief comment about homeopathics, because I think homeopathics really get a bad rap. A lot of people have, I think, very negative views on homeopathics overall in general. Maybe not you guys, but I think in our population we do. And I think we saw that play out in the media a little bit too recently. So I do want to make a little comment on homeopathics. First of all, homeopathic has been around for hundreds of years. I think it's pretty cool that it's taught in European medical schools, so it's quite normal over there. And they actually have homeopathic hospitals set up. But I graduated from the University of Waterloo, and what I get in the mail is I get these magazines that tell me like what the university is doing and what the latest research is. And one day I got this magazine in the mail, and it was talking about how they were doing this latest and greatest technology called nanotechnology. And so with nanotechnology, what they were finding was that they were doing the studies with pharmaceutical drugs, but when they were using small amounts of these pharmaceutical drugs, they could, and that you couldn't even see it, you could only see it with an electron microscope. So they're such small particles. And when they're that small, they were able to target different systems of the body, and they were able to get a better response because they were able to absorb it better and actually get stuff into the cells. So this is the latest information that's out there. And that's actually very similar to how homeopathics work. That they are just really small, minute substances that you could probably only see with an electron microscope. And it's targeted, and because it's small particles, we can actually get it into cells. So it can influence cells that way. So that's my kind of a little aside on homeopathy. So liver drainage, and I use these remedies a lot. So one of the things that differentiate some of these remedies that I use, so in terms of hepatica and cardus, and I don't have cardus up there because cardus I put under gallbladder, which I'm going to get to. But in terms of hepatica and cardus, hepatica I use if there's no constipation. If there is constipation, then I use cardus. So that's sort of the differentiation between those two, but both really effective at treating the liver and making sure that we get that liver moving a lot better. Now the cardinaris, it's an artichoke extract, and I will use this one more for if there's cholesterol issues, so high cholesterol. So instead of putting patients onto statins, this can be one. This can also, because of that cholesterol connection, it can also be used with any sort of hormonal issues. So liver congestion leading to hormonal issues, the cardinus works really well in those kind of situations. And then once we've done the drainage, then we can do some of that other support to get that liver functioning well. So the Traxica, what it's helping to do is it actually has nutritionals and it has botanicals. Just to kind of, I'm going to backtrack a little bit, but the Nestmann products, they have botanicals and homeopathics. So I like it because it's supporting organs both on that cellular level as well as on that biochemical level. And so when these substances have the nutritionals and the botanicals, then they're supporting the system on those two levels as well. And then the Heparplex, what it is it's mainly just your botanicals that help to support the liver. And then nutritionally, things that we could be doing to help support the liver from a nutritional point of view is the brassica family. And the brassica family does help to support both that phase 1 and phase 2 detoxification. Lemons, squeezing fresh lemons into some water in the morning does help to stimulate that liver. Adding a turmeric to our foods on a regular basis does help to tons of studies on turmeric in terms of helping to support decrease inflammation, help to support liver detoxification. And glutathione, like really anything we can do to support proper glutathione manufacturing, from taking glutathione as a supplement, from having the foods that are precursors to glutathione, to another thing that we can take is NAC. NAC helps to manufacture glutathione. I was just at a conference this weekend. I don't know if anyone else was there, but one of the things they were talking about was that NAC is very important for helping to support phase 2 detoxification. But she was saying that you need to dose high in order to drive that phase 2 detoxification. And the challenge is the reason you got to dose high is because when that system is super toxic, it's really tough to get that into the cell. So that's why we got to dose high. And that'll happen with drugs as well. You'll see that with drugs and supplements, that we got to increase the dose in order to get that in order to get that action that we want from it. But if we clean up those spaces, we do the proper drainage, we clean up those tissues, then we don't have to dose as high in order to get these systems to actually move. And the other thing lifestyle-wise is just decreasing alcohol content would help to support liver. Now, talking about the gallbladder, and I think the gallbladder tends to be this ignored organ. And what happens in terms of the gallbladder, what it actually does is, so first of all, the liver makes bile, then the gallbladder stores that bile, then the gallbladder will release, as we eat some fats, it'll release some of that bile into the small intestines. It helps to metabolize fats as well as fat-soluble vitamins, and then it gets reabsorbed, that bile gets reabsorbed into the enterocytes and then gets recycled. So then it heads back to the liver, and we actually only have a set amount of bile in the body. So it's a dynamic system that constantly needs to be recycled. So one of the challenges is that if we have some lipophobic, so those fat-soluble toxins that are stuck in that bile, we're actually over time just re-toxifying that liver, because that bile is just recycling. So that's why gallbladder and getting the bile moving is really important, because what can sometimes happen is that bile is actually very stagnant. So we need to get it moving, because if we're having any difficulty digesting fats, so those are the patients where they had a big steak and now they're getting stomach cramps. And it's usually because one of the reasons can be that they're having difficulty digesting those fats. So that can be a sign that we're having gallbladder issues. Now, another thing is that gallbladder can actually be a site of focal infections. So I often think of focal infections as those infections that you get when you have root canals, because it's just a stagnant spot. It's a spot where infections can fester. But that can also happen in the gallbladder. And the reason that can happen is because we actually don't have a blood supply to the inside of that gallbladder. So what you have is you have a constant pH. And if we don't have proper movement of that bile, that can be a spot where we actually can produce an infection. What's interesting is that they've actually done studies on gallstones. And it used to be thought that the gallstones were really just dead material. But when they looked at those gallstones underneath the microscope, they actually found that there was live bacteria in those gallstones. So what's happening is that we can actually have living bacteria living in that bile, in that gallbladder. So one of the things in terms of getting that gallbladder working better is getting that bile properly flowing and increasing that flow. Now, bile also it gets released. It's really more, as that chyme comes out of the stomach, it's really acidic. And when the bile gets released into that small intestines, it actually helps to alkalinize it. And so it actually helps with proper bowel movements when we have enough bile. Now, the other thing that bile does is, I think I'm giving it away, but do you know what makes our stools brown? Little bit of trivia for you. It's bile. So it's bile, it's bilirubin, and it's broken down red blood cells. So that's what makes our stools brown. So if someone is presenting to you with yellow or pale stools, then that tells us that we have issues with proper gallbladder or bile flow. And the other thing that we can see is when patients tell us that they're having floating stools. Remember, our bowel movements tell us so much about what's going on inside of us. So I'm always asking about bowel movements because it tells me so much. And when their stools are floating, it means that they have a lot more fat in their stools and they're not properly metabolizing the fats that they're eating. And on an emotional level, what we see with congested gallbladder is we see resentment and mad as in terms of the emotional aspect of the organ. So one of the remedies that's really great for helping to support that proper bile flow and support that gallbladder is Cardus. And so I will use this if we're seeing constipation in patients, as well as seeing any of those gallbladder symptoms. I will be using Cardus. Cardus also helps to support the liver and that bile flow. So I always say that it's working on both the liver and the gallbladder. Cardus is also a bitter, so it's helping with proper digestion. And you can use Cardus even if they've had their gallbladder removed. It's still helping to support that system. Also helps if they have gallstones. So really what it's helping with is it's helping with that proper bile flow and that whole recycling of the bile. And nutritionally, what we could be doing is artichoke and dandelion are different things that we can be incorporating into the diet, and that helps with gallbladder. Now we got our kidneys, which is our next major organ of detoxification. And what the kidney's doing is basically what it's doing is it's filtering the blood and moving that toxic load out through our urine. And it really does three main things. It's filtering out medium-sized and small molecules or toxins and helping to move those out through the urine. The other thing that the kidneys is doing is it's doing something called passive filtration, where it's taking fat-soluble toxins and moving, again, those fat-soluble toxins out through the urine. And then there's also active filtration. And the active filtration means it needs that ATP in order to move that toxic load out. And anytime we're seeing, so because it's working with the fluid, sometimes we can see that fluid retention. We'll see it as edema. We'll see it as swollen feet, that when you're getting that swollen ankles, a lot of people will say at the end of the day, I'm getting some swelling in my ankles. The other thing is that you can do it from looking at your patients. So they'll have like the puffiness just underneath the eyes. That'll tell us that it's more kidney related. And any sort of urination problems, from chronic UTIs to having to go to the washroom more frequently. Sometimes it's really tough to gauge, but really we should be drinking, the amount of water we're drinking should be about the same amount of water we're peeing out. So if you find that you're drinking but you're not peeing as much, or you're drinking and you're peeing a lot more, those can both be signs that the kidneys are not functioning at their best. And feeling tired, sluggish, all can be related to kidneys. I think the reason we see like the pain in legs is usually because you're just having some of that increase in swelling and water retention. And the itchy skin, it's usually related again to the liver, kidneys not working at their best, and the body will move that toxic load out through the skin. So we start to see those kind of symptoms with kidney dysfunction. And I think this is pretty small, but I hope you guys have the notes as well. So great drainage remedies for the kidneys is the Solidago. So it supports the kidneys. I use this quite frequently in terms of kidney drainage, and it can be everything from the kidneys to that whole urinary tract. And the Buco I use a little less often. I use the Buco more when they have either a weakness of the kidneys, or they've had chronic kidney problems. So then I'll use the Buco. But Solidago is just a really good general kidney drainage remedy. And then in terms of nutritionally, there's a number of things that we can do, but the big one is that kidneys are really about microcirculation. So any of the foods that we can eat that increase microcirculation, so those nitric-rich foods will help with that, and a number of herbs will do it. So the ginger, the gotu kola, and the ginkgo biloba. Those are different herbs that help to improve that microcirculation. Lifestyle-wise, we need to be drinking enough water. I think that overall we are dehydrated. So we need to make sure that people are drinking, at least 2 liters, and making sure that it's filtered water, drinking that a day. Protein consumption, high amounts of protein consumption can be challenging for the kidneys. I usually say, and I know that this is kind of up in the air, but I usually say 4 ounces of animal protein per day, tops. I know Dr. Rao says a lot less. He actually says not having animal proteins so that we can decrease this load and get stuff moving, because animal proteins are more acidic, so it does contribute to that more acidic environment in the body. And I think that because he's dealing with really difficult cases, and because he's dealing with like lots of chronic disease, lots of cancers, that a fast way to switch over that environment is to remove the proteins. But I say if you have limited amounts of protein and cleaner sources, and when I say cleaner sources, I mean wild or organic grass-fed proteins are going to be, I think that they're okay. But I know lots of people are on the fence about that. But that's my prescription. Salt consumption, and I think the challenge with salt is that we want to be staying away from the refined salt, and a lot of the processed foods have the refined salt. Salt in general, in limited capacity, is actually not a bad thing. We do need some of that sodium. So in terms of like the salts that would be beneficial. Like the Himalayan salts have been shown to also have 90 trace elements in them. So one of the things that Rao does recommend for his patients is he actually recommends that they have a teaspoon of Himalayan salts a day in order to get those trace minerals and to support that proper pathway. And then we want to be removing some of these phosphates. And those are from your carbonated drinks, those are from breads, flavoring. And the challenge with them is that they're affecting and they're decreasing our microcirculation. So back to this beautiful picture of the lymphatic drainage. And so I'm going to be talking more about lymphatic system. And what we need to know is that the lymphatic system, it's a closed system. It doesn't have valves. It has mini valves, so stuff can go in, but stuff can't go out. But because it doesn't have a valve system, we're really dependent on the venous system as well as our muscular system to move the lymphatic system. And if that lymphatic system's not properly moving, then what can happen is that that toxic load that it's trying to clean up the tissues actually gets reabsorbed, and then that system gets even more congested. So ideally, the lymphatic system should be kind of like the consistency of water. But as it kind of reabsorbs that toxic load over time, it ends up being a bit more like sludge. So that's why we need to get this dynamic system moving a lot better. And so I think I talked about all that stuff. So some of the signs that the lymphatic system is out of balance is that we start to get congestion in that superficial lymphatic system. So we start to see sinus congestion or sinus infections, those ear, nose, and throat congestion. One of the things that you can see as well is you see the dark circles under the eyes, and that would tell us that the lymphatic system is more congested. And because the lymphatic system just plays such a big role in terms of our immune system, we see a weakened immune system. Now, some of the drainage remedies for the lymphatic system, trying to get that whole lymphatic system to properly move, is the lymphodrop. It helps to stimulate that lymphatic system, get it moving a lot easier. I use that one a lot. And then the LAPA, I use it less frequently, but it doesn't mean that it's less important, because the LAPA is doing the lymphatic drainage, but it's also doing this in terms of helping to clean up any of the blood as well. So we call it a blood purifier. So it's cleaning up all of that blood circulation as well as cleaning up that lymphatic system. So it's more of that broad spectrum one. Lymphatic system, lemons, greens, proteolytic enzymes help to break down any of that fibrin or debris that's, that inflammation is causing in the body. And some of the lifestyle stuff we can be doing is that dry skin brushing. So dry skin brushing, if you're not familiar with it, lymphatic system's really superficial, and usually you're using like a loofah sponge and you're just going really gently over the skin towards the heart, really gently over the skin in little tiny circles. Castor oil packs is another way that we can activate the deep lymphatics, so we can have our patients doing these castor oil packs. You put castor oil onto a piece of flannel, then you put that on the abdomen, then you put a piece of plastic over that, and then you put a heating source over that, and the heat just helps to drive that castor oil into those deeper layers, stimulates that lymphatic system. And rebounding is also an excellent way to get that lymphatic system moving, and so getting one of those little mini trampolines does help to get that lymphatic system draining a lot easier, because lymphatic system congestion is definitely a challenge point, because it's cleaning up all that those tissues, moving that toxic load out. And I think the lymphatic system is often a forgotten part of the detoxification programs. Now, lungs. Now, with lungs, it's usually that they have like a a weakness of the lungs. So these are your patients where when they get sick, it tends to go to their lungs. So just when they have a cold, they tend to get bronchitis. Sometimes it can actually lead to pneumonia. So they're more susceptible to that. Or they're the patients who either they've had it in the past or they have it presently, but they have asthma. So it's just a weakness of the lungs. We'll see it. The shortness of breath. So all I did was I walked up the stairs and now I'm just having difficulty breathing. So I usually call that constitutionally weak lungs. And these are the drainage remedies for the lungs, is the broncha. The broncha works really well in terms of helping to support the lungs. One of the challenge points is that most of us actually aren't breathing properly, believe it or not. Most of us are actually just breathing with the top lobes of our lungs. And we're actually not using our full lung capacity. So, and so this is actually leading us to more problems because our lungs are one of the ways that we're moving that toxic load out. So we need to actually be using our full lung capacity. So these drainage remedies will help, nutritional support will help. But what we need to be doing is we need to actually be doing some deep breathing exercises. And even if you're doing this like you're stopped at a stoplight and you start doing your deep breathing exercises, you can do this like any time of day, but doing those deep breathing exercises actually helps to alkalinize our tissues. Exercise and movement, because exercise and movement actually forces us to actually use our full lung capacity. So that's one of the reasons it's helping to support the lungs. Now skin, and skin is one of those, oops, I'm throwing this around. Skin is one of those things where, you know, when our patients present with skin issues, we're so tempted to jump to the skin remedies and start to use those right away because we want to, you know, we want to help our patients as quickly as possible. Anything that's showing up on the skin, from psoriasis to rashes to acne to eczema to rosacea to getting hives and itchy skins, blotchy skin, anything that shows up on the skin is telling us that we have internal imbalances. So when it comes to skin issues, I always say that you got to clean up the body from the inside out. So one of the great remedies for the skin is Luvos. And Luvos, what it is it's an earth mineral. It's really porous. And because it's so porous, it helps to like grab onto toxins. So those can be any of those toxins in the gut from external or internal environment. It can be some of those toxins that we're producing in our gut from eating the wrong foods, from that putrefaction, from that fermentation that's happening. It helps to clean that all up and move that out. So we can use those caps internally. But externally, what you can do with those Luvos caps is that you can take some of that Luvos powder, you can mix it with some water, and then you can put it onto psoriasis, or we can do it on the face as facials or acne. What's really interesting is that Luvos in Europe, it's the #1 over-the-counter acne treatment. So that's how well it works. What it helps to do is it helps to balance out that skin, helps to move that toxic load out, and increase circulation to the area as well. Yeah, so it works really effectively as that mask, as a natural mask, really. And the I'm like, is that my time up, Belle? I'm like, oh, I'm not through yet. Okay, nutritional support, doing some healthy fats, doing bone broths, because then we get the collagen, so we're giving the body the proper nutrition to be able to repair and support the skin. And lifestyle-wise, we want to make sure that everything that we put on our skin gets absorbed into the tissues below. So we want to decrease the toxic load of the substances that we're putting on our skin. And I always like to remind my patients of this because often that's something that they won't actually think about. And a lot of people, you know, when they're coming in with skin issues, they're trying to find which cream can I use to help get rid of the skin issue. And I usually say we got to clean things up from the inside out, and I want you to stop using that toxic cream and try to find something that has a lower toxicity load. The other thing that we can be doing for our skin is sweating. So sweating is another way that we're moving toxic load out, and one of the ways you can do that is with infrared sauna. But any way that you can sweat also helps to clean up the skin. Now, a big topic, and again, I have like this huge topic on just one slide, but heavy metal toxicity, we're seeing it a lot, and one of the reasons we see it a lot is because as our soils become more depleted in minerals, our foods actually now have higher heavy metal content. So that's why we're actually starting to see higher amounts of heavy metals in our population, is because of the poor quality of the mineral balance in our soils. We also see it because it's really high in our environment. We see it with dental amalgams in the mouth. So lots of ways that we're getting toxic loads into our body. And there are great effective ways for us to safely move that those heavy metals out of our body. And the Biorella, which is now called chlorella, made up of chlorella, helps to bind those heavy metals, and those are the heavy metals that are within circulation, and it helps to move that out of the body. And then the Cilantrex, what it helps to do is it helps to mobilize those toxins, so helps to bring those toxins into circulation, and then the chlorella helps to grab onto them and move them out. So what I typically do, and I don't know if you're probably handing out, but what I typically do with the Cilantrex is I do one in the morning, one at night for 1 week on, and then 2 weeks off. And then if they're doing okay with that, then I will increase it to 2 in the morning, 2 at night for 1 week, and then 2 weeks off. So, and then I usually pair this with Solidago, because as you mobilize those toxins, those heavy metals typically will move out through the kidneys. So if any of those heavy metals are moving out through the kidneys, you're supporting the kidneys as well. Heavy metals, I think, are really important just because we have a lot of them in our environment, and it's really important that we work on taking them out. So proper steps to improving detoxification. And I think what we also have to remember is that all of our cells are moving toxins out. And so we have to find a balance point of how quickly or how well our cells move that toxic load out, and then how well our detoxification organs can handle them and then effectively move them out. And so this is the whole process that we're trying to support. So our steps are that we first want to limit that exposure. So we want to not keep putting toxins into that barrel and start building them up. We want to make sure that we're properly eliminating. And this also comes down to, we need to make sure that we heal the gut, to make sure that we're properly eliminating before we do any sort of detoxification program. We've got to make sure that we heal the gut. And then we have to do the drainage. So that's kind of the groundwork. We got to make sure that we're moving toxins out of that intracellular space and that extracellular space before we do any of the other drainage, because it's going to be more challenging. We have to make sure that those areas are cleaned. And then I call that biotransformation. So it's changing those toxins from that toxin that's unhealthy for us, that would be more harmful to us, to a material that's less harmful. And so that's where that biotransformation happens, and we need those proper nutrients for that biotransformation to happen. Okay, that's it. So thank you so much for being here. I appreciate you. I appreciate you guys taking the time to not just eat your meals, but to stay and listen as well. So I hope you found that valuable and interesting. And I'll be around if you have any more questions for me.